My name is Kenna. I am 18 years old. I graduated this past May, and all 4 years of high school I was a rower. Well, my fall season of rowing, my senior year, I started experiencing lower back pain, and I definitely knew it was there was something wrong with my back because I'd never had this pain before. And when I brought it up to my coaches, they told me basically to push through the pain, and I didn't think that was right, and so that's when I kind of started seeking help, and that's what brought me to see Dr. Kikari. When I first started experiencing pain in my lower back, I thought I could push through the pain at first. I really tried to, but it got to a point where I honestly couldn't even get through a whole practice without stopping or telling my coach that I needed to sit out. And so it really started affecting my senior year of rowing, which was a really important year for me. Basically, in the process of rowing, you go from a compressed, hunched over motion to extending completely, and that back and forth movement, thousands and thousands of times over 4 years, just honestly wore out my discs in my lower back. The lower back is very involved in rowing. Like I need my spine, I need all my lower back muscles, and so this pain and inflammation was keeping me from practices, from certain races. I was out of the boat for a whole week just on bed rest basically, so it really did affect me, which motivated me more to seek out some way to fix it. When I first started looking for, I guess, a fix to my lower back pain, I saw multiple physicians, multiple doctors, started physical therapy, and they all told me that there was damage to my spine, especially the lower discs, but they didn't really pinpoint what was actually causing my pain. The first time I went in to speak to Dr. Kikari, I was a little nervous because I didn't know what to expect. A lot of other doctors gave me generalized diagnoses. And so when I finally met with him, he looked at my x-rays, my MRIs, and examined my back, had me do different motions, and immediately told me that the pain that I was feeling was inflammation of my facet joints, and that just gave me a lot of confidence that he knew what he was doing. It was almost instant that he recognized it. When I first heard that I'd have to have surgery, I was pretty nervous. I didn't like the idea of getting injections in my spine. I didn't like needles whatsoever, but the more I talked to him about the process and the more he explained to me, I started to feel a lot more comfortable with it. I was very, very nervous, and they definitely could tell, but they honestly kind of treated me like family, which I really appreciated. It put me at ease, and it didn't make me as nervous or shaky. Like, multiple nurses came in to check on me to make sure I was okay, make sure I was like completely prepared for everything, and I met almost everybody who'd be in the process of my facet joint injections, and so honestly they just made me feel very comfortable with the whole situation. Since my last facet joint injection, I have graduated high school, and I was able to compete with my team at the Youth National Championship for rowing, and we actually did very well in that, and that was the ultimate goal, was to be able to finish out the season with my team. If I could give advice to anybody in a similar situation to mine, I would definitely tell them to go with your gut, and if you are experiencing pain, especially in the back, that you know is not normal, I would advise them to seek help as soon as possible, because if you just leave it, it's never going to get better on its own, and there are definitely things that you can do to help your pain.